confirmed case of COVID-19. Health Minister Kwekwa Menu made that announcement, announced the 2 cases at a news conference. There have been 9 more confirmed cases after that announcement, forcing President Akufo-Addo to issue an executive instrument banning all social gatherings and closing down schools. Today we ask, what more should be done? Yesterday there was a powerful prayer session at the Jubilee House. We're also asked to pray, but also take the necessary precautions. So we've got a public health specialist in the studio, Dr. Paul Owusu-Oduro, to help tell us there are children at home. Some people are working from home, but some of us are still working. So there are a lot of conversations to be had around this. Thank you very much for making it.
Good morning.
You're welcome.
How are you?
I'm doing very well, by God's grace. Yeah. Good morning to your cherished viewers.
Sure.
Let me start by allaying the fears of everybody. We've recorded the 11th case. It sounds a bit alarming, especially looking at the information that we had concerning the 11th case. If it is a possible community transmission, then it becomes difficult. I will explain why it becomes difficult as we go along. As of now, prevention is obviously the only way to go. And we don't know who is carrying the virus. As far as we know, information concerning this novel virus is quite scanty. So it is similar to the one that caused SARS in 2003, the SARS-CoV. So technically, this one is called SARS-CoV-2 because in terms of the gene, it shares about 82% similarities with the SARS-CoV-1. That is why we call it SARS-CoV-2. Because we know quite a lot about the SARS-CoV-1, most of the things we are talking about now are how the SARS-CoV-1 behaved. We are assuming because it is similar to that, then the features may be the same. But we may be wrong because there are evidence suggesting that it may be more than we know. And as information keep coming up, things may change as far as precautions and all those things. But for now, we will stick to what we know, which is true droplet infection and then touching contaminated surfaces. For the droplet infection, it is thought that if it is a face-to-face contact, chances of you getting it is quite high if you are in contact with that patient for 15 minutes.
So where face-to-face, help us appreciate that with the distance as well.
Okay, so that will be at least, within 1 meter radius.
Okay. Is 1 meter like what is between you and Roland Walker right now?
You know the big ruler.
That 1 meter rule.
No, that is not a 1 meter rule. That is 30 centimeters.
Oh,
the
really?
normal one we use in school.
You always mention that it was a 1 meter rule.
No, that is 30 centimeters, which is approximately 1 foot. And 3 of that is approximately 1 meter.
Okay.
So we need
3 feet.
If it is face to face.
That's right, yeah.
3 feet.
And if it is not face-to-face, but you happen to be in an enclosed environment with an infected person, then you should have been in that environment for at least 2 hours before your chances of catching the virus will be increased.
Oh, okay.
So we are more concerned with the face-to-face, even though the other way, which is in an enclosed environment, but you have to stay there for at least 2 hours.
Okay, because you're not directly interacting with the person.
Yes.
Okay.
Yes.
But then how can you potentially get it if you're there for 2 hours?
Okay, good. So it's still scanty. Information has that the virus can suspend in the air for a limited number of minutes. So if you are in the environment with an infected person who coughs, sneezes,
you'll be inhaling.
Exactly. But it has to be close contact to some extent. Yeah.
Okay. And the close contact is less than 3 feet, you see?
Yes.
Okay. Now, if somebody stayed in a room, let's take this studio, an infected person walks in and stayed for 30 minutes, but then coughed, blah, 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 but left. How do we just oppose that with a 2-hour period where the...
Okay, as I said, your chances of getting the infection increases when you stay in that closed environment for at least 2 hours. So if it is less than 2 hours...
the infected person came in here, less than 2 hours, walked out. Let's say 30 minutes. We're having this conversation for, let's say, 45 minutes. Okay. The person has walked out.
That's right.
But the rest of the crew is here. We have a cameraman, we have anchors, we have staff, and they're all here. The infected person is out. Yeah. But may have coughed, may have sneezed or done whatever.
Okay, good. So with this, we are talking out of the droplet infection, where you can inhale if you are in close contact with a person. But if it is face-to-face, it just has to be 15 minutes. But if it is not face-to-face, then probably you are behind a person. But because you are in an enclosed room, chances are that it may stay suspended in the air for a while, and then as you walk and get closer, you may inhale it.
There are related issues about how the transmission is done. Until the 61-year-old Kumasi business person,
the trader,
got infected. Nobody in a typical community in Ghana reported symptoms.
That's right.
So how would we have gotten to this man? Or how would this man have gotten this infection, ideally, in a hypothetical situation?
But that's because in all the other cases, it's been clear that they're imported. So we know one didn't have this one didn't come with any special qualification.
Exactly, yes. So this is where the risk of community transmission comes in. Community transmission comes in when you get an infection in an environment where the person hasn't been in contact with an external source, as in beyond the borders of our country. So that is when community transmission comes in. For this virus, research has showed, even though the data is limited, that persons can be infectious, even though they don't show signs and symptoms. That is what we call asymptomatic or carriers. There was a paper published in the England Journal of Medicine. Data was limited anyway, because in science we look at data, sample size to make generalizations. So it's difficult to make a generalization in this case. But since we still don't know much about this, it's important we get to know.
No, please go ahead.
It's important we get to know a lot as possible so that we can be well armed. For that publication, 19 confirmed patients from Wuhan, swabs from their nose and throats were taken. 18 of them were symptomatic, which means they were exhibiting signs and symptoms of the disease. 1 was asymptomatic, no signs, no symptoms. So they swabbed the nose and the throat and then did PCR on the samples. Surprisingly, the quantity of virus in the nose and throat of the one that didn't show signs and symptoms was similar to those that were symptomatic.
Yeah. So was he positive or not? That's what.
No, he was positive but not exhibiting.
Exactly. But the viral load in the nose and throat were comparable to those that were showing symptoms.
So in such an asymptomatic situation, or in such a case, how likely is the person not exhibiting the signs being in the community and that could be transferable?
It is very likely, because a report in the Washington Post has said that as at 23rd January 2020, when Wuhan was shut down, approximately 86% of those who had the infection were undetected. As in, they didn't exhibit signs and symptoms, or probably they exhibited mild signs and symptoms. And because generally around this time in Asia and Europe is the flu season. Most people mistook it for a common seasonal flu. And then that is how come the cases spiraled in Wuhan. So asymptomatic transmission is something we have to be very cautious about. And with this Lebanese case, it's obvious the source is asymptomatic. Or perhaps he's exhibiting signs and symptoms, but probably playing mischief. Doesn't want to submit himself to any medical facility for him to be tested or not, or something. So it's either ways. Either he has the signs and symptoms, but he's hiding it, or he's asymptomatic and then transferring the infection, which is very likely.
Well, he's now positive, and it's been determined by Ghana Health Service. So,
what I'm saying is the source, as in where he has gotten it. Either that person has signs and symptoms, but he or she is hiding.
There is a danger, though, because there are people who return and isolate themselves and not show any signs. And then it means, because after a period when you don't show, then you're good to go.
14 days, they say.
That's right.
Yes. But if you're keeping it, if your system is such that you may not show it, but you have it, then that still could be deadly.
It's only a few people, statistically. I think there was a case in Wuhan, China, where one man, he ended up infecting a lot of people around him. Meanwhile, he didn't show any sign or symptoms of the infection.
Within what kind of period?
It went past the 14 days, actually.
Okay.
It went past the 14 days.
You mean his was detected way past
14 days, yes.
So it means
but
that
it is an extreme case. In science, we deal with averages. You can't keep somebody for 21 days, 28 days or something. So we deal with averages. But we have extremes. So his was probably the extreme.
Okay. I have a question on that before Roland comes in. What do you know about the contact tracing that we're doing? Are we testing each person who has come into contact with a carrier?
A confirmed
case?
Or
are we testing each person?
No, we are not testing each person. What Ghana Health Service is currently doing is, if you identify it as, it's not even all contacts, but close contacts. And close contacts are defined as those who came into contact with the patient 48 hours prior to the onset of symptoms and within the 1 meter radius. So those are the primary or the
But
close
how can
contacts.
a person remember all those details?
That is a problem, because we are relying on the memory of the patients, and it is dangerous to let a wild beast on the loose. It is more dangerous if the wild beast doesn't know he or she is even a wild beast. So contact tracing is important, but it must be done well. As far as I'm concerned, the only difference between what the Americans are doing and what we are doing is, for America, they test all the close contacts. But for Ghana, we observe them, those that develop symptoms and signs as they are in quarantine, are those that we test for the virus. But if we are looking at what probably happened in Wuhan, where somebody harbored the virus for more than 14 days without knowing, if any of those contacts happen to be one of those extreme, then he or she will be cleared negative, set out.
That will still be carrying it.
This morning, I was listening and in Italy, we have about 9 doctors who have died, and some nurses have also passed. So it means that those are frontline.
Yeah.
And this one, I'm not talking
And
health.
in China, 13 doctors.
Okay, so but I'm not even talking health in my question.
Okay.
I'm talking because they are imported. They are from elsewhere, infected countries. Take us through 48 hours prior. Their contact then will be in the infected country. But in the plane, through to immigration, etc., no matter how maxed our officials are, if somebody, as you take us through, two, if somebody has a strong immune system, could that person be an immigration officer, etc., and be asymptomatic and be there and be, is there a likelihood? I mean, just not to alarm people.
Since
let's say somebody is in a plane, let's start from that point.
Okay, good. So for the close contacts, the definition, if you are in a plane, the definition is those who sat on the same row as you are, and then 2 rows behind there. Those are considered close contacts if it finds out that a traveler turns out positive for the virus. And it is so because those people are thought to be in close contact. Because 2 rows, if I turn 2 rows, it may be within the 1 meter distance. And if I look ahead 2 rows, it may still be within the 1 meter radius. So that is how we define close contact if you happen to be in a plane. For someone catching and not knowing, I am not too sure the kind of protective equipment the port of people are using. But ideally, if you are in contact with a positive patient, as in if you are taking care of a positive patient, the mask that is recommended is the N95. That is a bit expensive. It is different from the conventional face masks that people wear around.
You are claiming.
Is that different from the surgical one?
It's different.
So you are saying that if we don't have the prescribed masks for our frontline officials, and they come into contact with a positive case that they didn't know of, these are the risks.
Yes, they can get it because asymptomatic transmission is possible. Because at the port of entry, they check temperature. Fever is one of the classical symptoms of the infection. So if they check your temperature and then you have fever, then you are isolated and then you are taken care of. But if you don't have fever and you carry the virus, at that point you are asymptomatic. But based on evidence that is coming up, asymptomatic persons can also transmit the virus.
So the surgical one, is that the lighter one?
Yes.
Okay, but that's only, I think I was reading about it yesterday, that's to prevent splashing, in
or sputum and all that.
In the events, if you're carrying out a surgery, that's explained. That's just to prevent particles from getting into?
Ideally,
or
if you are performing a clean surgery, as in sterile, you, the surgeon, you wear the mask primarily to prevent secretions from you, the wearer, getting into the patient. Because it may not be infectious, but there are microorganisms we call normal flora. They are found on the body and then inside the body, some part of the body. But those microorganisms don't cause any problem. And it is because the area they find themselves, there are physical and chemical characteristics of that area which prevent those bacteria or microorganisms from multiplying excessively. Usually if they multiply excessively, that is when they cause problems. So if I have a normal flora in my mouth or nose, as long as it remains in my mouth or nose, it won't cause any problem. But if it leaves my mouth or nose and enters a different site where the barriers there are unable to prevent it from multiplying, then it can cause infection. So what the surgical mask basically does in surgery is to prevent secretions from the surgeon entering into the patient and then causing infection to the patient later. Ideally, if you are sick, in relation to the COVID-19, and then you are coughing, you can wear that, but it is to prevent other people close by from getting it. But if you wear if you don't have and you wear, and someone has the COVID-19, and then coughs or sneezes, and you think you are protected,
you're not.
You will be lying.
Okay. Typically.
Okay, so sorry, Roland, because Fred, our director, has put the surgical. This is the surgical mask
that's
you're
the
talking
surgical
about.
mask, yeah,
Okay,
that's
so
surgical
all the descriptions that
That's
you
right,
give.
yes.
He's going to give he's going to show us the other one that you talk about. This is the other one.
N95.
This correct one.
I can promise you, I haven't seen anybody wear this in Ghana, have you?
I've seen it in photos, but not Ghanaian
Please,
photos.
I mean, you are the one who is close to the action.
Yes, for some healthcare facilities, they have the N95.
In Ghana?
Yes.
Okay, great.
It is quite expensive, so ordinarily. I think currently it's in short supply. So WHO has recommended that only healthcare personnel who are taking care of the COVID-19 patient directly are supposed to wear this because of the short supply. But ideally, any frontline healthcare personnel should wear this to protect you.
So ordinarily,
this is not even foolproof. The 95 means the filtering efficiency is about 95%.
I tell you what, I think yesterday I saw some of the people doing the test in America actually wearing this and also wearing some other mask. You know, this plain one, when they're taking the swabs.
You know.
That's right, yeah.
Okay.
So that is a full, I mean...
They're wearing the whole PPE, but they're wearing this inside.
So that is the full gear.
Sorry, Roland, I know you want to ask something. So if you're like a taxi driver, you're a food vendor, and I've seen quite a number of taxi drivers and drivers generally also wear it. You're saying that you're actually not protecting yourself against getting any COVID-19.
Actually, it is not recommended because those who don't know, when they wear, it gives them a false sense of security. So sometimes basic precautionary measures may not be observed, and that is dangerous. And even this, there is a way of wearing it. There is a side that must come out. And the side
the surgical mask.
Yes. If you turn it, you are doing yourself more harm than good. So it's better you don't wear.
Okay. We've all taken flights before.
Yeah.
You have a lot of people coughing out, and especially on the Accra Asian route. All that. Okay. And sometimes too, it's a social cultural problem. Or habits with the Asians. They cough, they sneeze. It's a normal thing that they do. Now, you're on a flight, and I know from here to, let's say, Dubai is about 8 to 9 hours. Depends on the flight these days. And from there to China, etc. Now, if you're telling me somebody has to be in for 2 hours, and the rules, etc., if that person is coughing, exhibiting the signs, what's the probability that everybody in that flight, within an 8-hour period, could be exposed?
The probability of everybody, I mean, as in you inhaling or the droplet falling on you, is quite minimal for those who are outside 1 meter.
Okay.
This 2-hour thing happens in small enclosed areas. Because as I said, the research has shown that the virus, when you cough or sneeze, the droplet that propels out can be suspended in the air for quite a number of minutes. So repeated cough, and I mean, if the person comes and coughs once, chances of it remaining there is quite small.
Even in moist, cold environment?
If it is repeatedly, that is when you have a lot of droplets in the air, possibly, and then you can catch it. But the plane is quite big. I mean, in terms of the space, it's quite big. So if you are, say, 5-6 rows behind or in front of the person coughing, chances of you catching it in the air is quite limited.
Well, we're having an interaction with a public health specialist, Dr. Paul Owusu-Oduro. If you've got questions, kindly send it to us on our WhatsApp number. We're trying to educate ourselves. Ghana has recorded 11 cases. We've had a lot of deaths, scary moments elsewhere in Europe, in America, and in China, and everywhere in the world right now, really. So if there's anything that you think is worrying you, like, you know, you're hearing two voices, you can let us know and then we'll try and clarify that. There's a question on WhatsApp. This person says, I just returned from the US on Wednesday. I was cleared at the airport since I was not told to quarantine. I took the measures to go under self-quarantine at a private location. I am still fit and want to go home on Sunday. What do I do?
If he has been in self-quarantine for less than 14 days, for his own safety and that of the people around him, he shouldn't go home. He should maintain the 14 days mandatory quarantine.
Okay.
Yeah.
So I guess our friends, Wednesday to Sunday, it's still not enough.
Yes.
For you to, you're still not clear.
Yeah.
But I'm wondering why, and that's not a question directly to you, I'm wondering why we're not doing the mandatory, asking everybody once you return to keep yourself for the 14 days. I mean, that should be, you know, one of the things that we ask people to do, because if you're cleared, because they're just checking your temperature, and if you don't show the 37.5
yeah.
and you're asked to go, not everybody would do what this person has done in terms of isolate themselves.
Even the temperature monitoring, it depends on the quality of thermometer you are using. A friend contacted me to recommend a thermometer for him. So I did a quick online search, and what I found was these gun thermometers. Most of them had accuracy of plus or minus 2 degrees centigrade.
Please, what does that mean?
What it means is for the reading that the machine displays, the true value could be anything between, let me use figures for you to understand.
Okay.
If my temperature is, say, 37 degrees Celsius from the gun, if the accuracy is plus or minus 2 degrees centigrade, what it means is my true temperature could be anything between 36 and 38.
Plus or minus 2.
Yeah, so 1 on either side.
Okay.
So if you are using such a thermometer, and then you come in and your temperature is recorded as 37, it could actually be 38, which meets the definition for a case. So such a person, even though had fever at the point of entry, because the thermometer that was used was not very accurate, he will be cleared to go home.
Do we pray or hope that, just as you know this, many others also do?
I am not too sure, but it's important we look at what is being used.
Okay. Well, that's a great point.
And then
going
know
forward,
whether
we are asking questions.
we are safe or not.
Okay. Here's another one. Says a Ghanaian just returned from Italy a few days ago. He lives at our house and has been socializing. We've alerted the health authorities, but to no avail.
I am not too sure which health authority they alerted.
Okay.
But I think the directive from the Minister of Health, which was reiterated by the President on Sunday, had that as at, I think that one was with immediate effect, where if you are returning from a country that has recorded at least 200 cases, you will be required to self-quarantine.
Okay, so I don't know whether it's this very case. I know of a case. The person returned from Italy, and a friend called me, and the person was online, and I was just muted. It was a conference call. The person didn't know, and I listened to the person, and the ban came in at 1 also. That directive, immediate effects, came in at 1. He came in the morning. So he and his Italian friend, the white. So they were, and when he was even speaking, I think he had gone to Owusu-Oduro. From there, because he owns shops there, he went to import material, and then he had even gone to eat fufu. I said, "Me didi kra, o de chama me didi we na me mfrao." Now I say, so the person asks, "No, you know, man, or more, nyamya dominti ebe ye." And this one is not the say I heard. Yeah. But even before then, the airport officials, the port health official are supposed to call you on the side and say, look, even though this is not, because that was what we were told. We'll be told the passengers when they walk in.
But I just wanted to box that and say, if you happen to be the family, just like this message that came, this person is going around doing everything. What can you, the third party, as a family member or a friend, what can you do?
Because this is a public health issue, I mean, it concerns everybody. Public health is defined as the science and art of preventing disease, promoting health, and improving the quality of life through concerted efforts of members in a society. So it is you and I. As we speak now, I am not trying to instill fear in anybody, but I will be very surprised if we don't have undetected cases in our community. I will be very surprised.
Why do you say that?
First of all, the Lebanese case, and secondly, how the people at the point of entries go about their work. The airport may be tight, but the borders, we have very porous borders. And then if such people come in, Burkina Faso has recorded about 27 cases. I'm not sure if it has changed.
One death?
Yes, one death. And people cross from Burkina Faso into Ghana very often. So if you have such persons, and I don't know for a fact the temperature guns they are using there. So if the temperature gun is not accurate enough to pick the right temperature, then somebody with a fever can walk into the country, maybe a carrier, and be going about spreading the disease.
But the person, if you have a fever, don't you know you have a fever?
No. I mean, if your temperature goes, say, 0.3 degrees above the normal, you wouldn't know.
You wouldn't feel anything?
You wouldn't feel
even
anything.
Though it's on a high?
You wouldn't feel anything.
Okay. Now, people get worried about trotro, Okada, taxis, etc. And I have a couple of friends that I tend to have a lot of dialogue with. They're worried about this.
That is very true. But as it stands now, we try to advise that the trotro or whatever should be ventilated as much as possible.
Meaning what?
So as you sit in, you try to open the windows. And then if you are coughing or sneezing, because you may not even know you are a carrier. So if you are coughing or sneezing, you make sure you observe those coughing and sneezing etiquette so that you protect whoever is around you. As we speak now, taking precautionary measures is the only way to go, because you are not too sure who around you is carrying the infection.
Okay, so Burkina, you mentioned Burkina Faso, they recorded 33 now.
Okay.
Senegal is 36. Okay. Here's a question. Oh, but you can call us. You can give us a quick call. We can do this in about 5 minutes. 030221169102. Here's another message. We've got plenty of messages, by the way. If I contact COVID-19 and recovers, am I at risk of contracting the virus again?
Okay. Currently, there is no scientific proof to show that once you recover, it confers a long-lasting immunity on you. The reason being that a number of patients have recovered from the COVID-19 disease and have come back testing positive again.
They've been reinfected.
It is a bit difficult to say for now whether it is reinfection or perhaps
they remitted.
The viruses went dormant. At that point, if you are not shedding the viruses, then it may not be detected in the secretions. So they may be cleared as negative. But as they go out, the viruses may be reactivated and then it will come up. It is not confirmed yet. It is not confirmed yet, so we can't say for sure.
Let's speak to Robert in Kadishi. Robert, good morning. Thanks for calling. Please keep it very brief for us. Hello, Robert.
Yeah, Mommy, how are you?
Oh, very well, thank you. Let's hear you.
Yeah, thank you very much for Dr. Owusu-Oduro for the submission. I mean, I like the way he has relaxed explaining things to us. And what I want to say is that he talked about the thermometer, whether we are using the right thing. He said that sometimes is wondering whether it's the correct thing. So as a public medical officer, can they recommend the right thermometer to be used? And then also, I want to say that we always talk about the causes and prevention. Can they come out with medication as well?
Medication.
That has been my headache. They know, it seems they know everything about the prevention, they know everything about the causes, but the medication is out.
Okay.
And what is his opinion about the NIA registration that is still going on at the Eastern region?
All right. Okay. Thank you, Robert. You're so updated. I like that. I've been down in BBNE. Good morning.
Yeah, good morning.
Yes, sir. Thanks for reaching out. Let's hear you.
Thank you. But the distance that you are being seated on the studio, is it the recommended one that they are saying? And excuse me to also make my comment. You see, at times some people, when they are speaking, saliva do spit out of their mouth, especially when they are laughing or so. And now you are there and you receive visitors without using the mask. Are you people safe?
Okay. All right. I've been down. Thank you very much, Lucy. And after Lucy, please let's stop the call so that we can answer all the questions. Lucy from Cape Coast. Good morning.
Morning.
Yes, Lucy. Go ahead.
Please, about the sanitizer. I heard that when you get this alcohol and then you chop aloe vera and then put it in the sanitizer in the alcohol, it can be used to replace.
No, Lucy, say that again. You heard that if
I
you
want to be clear about it.
No, please ask your question again.
Alcohol, that is the application that people use. I heard that when you put, when you cut aloe vera or when you chop aloe vera and then you put it in the alcohol, it can be used as a sanitizer, and I want to be clear about it.
Okay, all right, great. Thank you, Lucy.
Thank you.
All right, let's go from the beginning. I'm sure you remember what the question is.
I thought the second question was for you.
Oh, I wanted to tell Bindal that it's the first thing that we asked the doctor off air. And then he said the face-to-face is more dangerous, but the way we are seated, okay, please, they want to hear it from you.
Okay, good. So
the first one, NIA.
Okay.
I thought you said we should answer Bindal's question.
So usually, the face-to-face contact is more dangerous. If it is face-to-face contact, you just have to be in that close proximity with a person for just 15 minutes for you to get the infection. But if it is not face-to-face and we are in an open room, or even if it's an enclosed room but it is quite wide, then chances of somebody catching it's quite low. So that is why in social distancing, I mean, we recommend. The social distancing basically is face-to-face. Okay. That is more to it than you standing behind somebody or something.
Okay, yeah. So again, Bindal said, some people laugh and they
spill.
They spill. Thank you.
Okay. Good.
What can you do? Because when you receive visitors, you're not wearing the mask.
Yeah. So that brings us to the asymptomatic route of transmission. For the SARS, for the one that caused SARS in 2003, it was thought to be replicating or multiplying in the lungs. So you will have to cough out or sneeze for it to move from the lungs into your upper respiratory tract before you can release it. But research has shown that this particular novel virus is able to multiply in the nose and throat. So what it means is, and I tend to support that, because if I am asymptomatic, it means I'm not coughing, I'm not sneezing. So how then can I transmit the infection? So there could be more ways than what we know. And that has been explained as aerosol transmission through close contact. Aerosol is fine particle, either solid or liquid, which is suspended in air. And most aerosols are able to survive in the air for quite a number of hours. But for the COVID, it is thought that the aerosol doesn't survive for too long in the air.
Okay.
But if you come into very close contact with an infected person who is producing aerosol, then it's possible you could inhale it. And that can also establish an infection.
Okay.
So even though the person may not be coughing or sneezing, if the person is a carrier and has active viruses in the nose and throat, you can get it, because aerosol production happens when you are talking. When you exhale, as when you breathe out, or even when you clear your throat to some extent, you can get aerosol.
So, you know, Robert said that you doctors and specialists are very knowledgeable with this COVID in terms of the prevention. Why don't we still know how to deal with this in terms of medicine to get it off our backs?
Okay, good. The nCoV means novel coronavirus. Novel means it is new. So we don't know much about how it causes the infection, the cause of illness, and all those things. Even if you are able to get a medication, you will have to do what we call clinical trials to see first whether the medication is working and whether it has any side effects on the people who takes it. And ideally, a good clinical trial may take up to 18 months.
We've heard of chloroquine and other stuff going around. What is Ghana doing? Are we testing anything currently ourselves? Are we trying some stuff?
Not that I know of.
Okay.
All what they are doing is supportive treatment. So if you have fever, they give you antipyretic to bring the temperature down.
Okay. Quickly, let me just ask, because Roberts also wanted your take on the NIA registration exercise that's ongoing.
Definitely. I think they came up with measures, not holding 25 people at a time there and all those things. But with all
what we are showing, Doc, is the front page of the Finder newspaper that came with the seating arrangements. So let's just say they're going according to the directives that they issued, which is spacing people out. What would you still say on the exercise?
That, to some extent, may limit the close proximity. So droplet infection may not happen here.
Okay.
But what we also know is that the virus is able to survive on surfaces. So the seat that someone is sitting on, if he sneezes, and then droplet gets into his hand, and then it touches the seat, whoever comes to sit on that seat and touches it picks it.
So you're saying we should even be disinfecting
exactly
the chairs that we sit
exactly
on. So there's still a lot of danger associated with going on with the exercise.
A lot. Nobody is actually safe. But once we practice the precautionary measures, which sometimes is difficult to maintain, we can actually do a good job.
Okay. There are other questions with if you share the same bathroom. So let's talk about the home now. We do a lot of things together. You share the same bathroom. If you're married, you're sleeping on the bed with the same person. They say social distancing, but you're still kissing and touching. I mean, what should couples be doing?
It is difficult for now because if you share the same bathroom with someone, he coughs or sneezes in the bathroom and it lands on any surface.
Chai.
You go in there, you touch touch your nose, face, eye, you can catch it.
Wow.
That is what makes it dangerous. And that is why it may be difficult to actually contain it as early as possible.
That's scary.
A bit scary.
So what
Because
would
of the
you
way
say?
it
What would you
spreads.
say we should do? Like, you know, don't share towel, don't share bath. That's impossible. So what should you? Because some of us use the disinfectant. I don't want to mention the specific name, but in bathing, is it helpful?
Disinfectant in bathing, generally, it's not recommended unless perhaps you have a skin condition or something. Because as I said, there are bacteria on the skin we call normal flora. They protect the skin.
Okay.
So if you are using disinfectant, it means you are clearing this protective bacteria. And then you will we come into contact with a lot of microorganisms. But because we have protective bacteria in there, you know, microorganisms, they have to eat to grow and all those things. So once you have a lot of those protective bacteria on your skin, if a harmful one falls on, before the harmful one can actually cause problem, it should have been able to multiply and then taking over the surface. But because you have protective bacteria on there, they will compete with the harmful one for food. So it's unable to get a lot of food to multiply that much.
Okay.
So it is actually not advisable to be using disinfectants in bathing because it kills your normal flora and it will rather expose you to harmful
Interesting.
bacteria.
That's something that I just started, so I guess I have to put a stop to it. Lucy asked the question of the akpeteshi and the aloe vera.
Okay. Basically, these sanitizers are a bit thick. So what the aloe vera does is to make it thick. But
it serves as a thickener.
Without the aloe vera, if you have alcohol, that is at least, I think the recommended is at least 60%, but I would say 70%.
70%.
Yes. If you have alcohol, that is at least 70% concentrated. That alone should be enough. You don't need to add any aloe vera to it. You can just use the alcohol straight.
That is 7. How would you know? The ones that we sell at the blue kiosk that we buy.
That is okay. I wouldn't recommend you buying the one at the blue kiosk. There are some in the pharmacy, we call them rubbing alcohol, isopropyl alcohol. Those are 70%. At least you can be trusted. But if the effectiveness of the alcohol drops when you are using a concentration below 60%. So we should be very careful the concentration we use. Other than that, you think you are protecting yourself, but
you're making it worse.
You are not doing anything.
Doc, we should have this session, regularly, so that we can do a lot of. There were plenty of questions. Some people asking for you to recommend the gun thermometer as well. So we can plan another session with you, and then we can do a lot more education. But we're so grateful for the education this morning.
Just 1 minute, a little advice to everybody, especially since we don't know the source of the Lebanese case. We have to treat anybody around us as potentially infectious, and then try to maintain the social distancing. Perhaps it has gotten to the time where we should be doing mass temperature screening at places that people gather a lot. Maybe the lorry terminals, the supermarkets. If we get the right thermometers, checking temperatures may be ideal for now because we don't know how many wild beasts are out there who are possibly spreading.
And who don't know they are wild beasts.
Exactly. So
I like the way
mass screening for temperature may be the way to go. I don't think we have come to a point where lockdown, it's
total lockdown is necessary.
It's recommended.
Okay.
Once, as individuals, we try to do what we have to, we should pretty much be able to contain the disease because the natural cause of the infection is if you have it, unless it is the extreme, within 14 days, either within 14 days, you exhibit the symptoms, which means the infection has been established. And then once you have the infection, you either recover or you die. So some way, somehow, those who have, we will find out at a point in time.
Yeah.
But as to when we find, that is the most important, because by the time you find, if he or she has given the infection to other people, it becomes difficult to trace.
All right. We're grateful for your time this morning,
Thank you.
Doc. Thank you
Very
for being here.
educative.